guys. We're going to wait 2 minutes. I hope everybody's having a really good morning. I am just very optimistic today that everything is going to be great and wonderful, no matter what the world has to say, right? We're going to make sure life is good, and the moments we spend on this earth, we're going to have a good time no matter what, right? It's a beautiful day outside. I hope you guys are able to get out and walk the dog, as you can hear mine, and do some fun things with your family and kids and all that good stuff. So I'm glad to have y'all on. I'll wait just one more minute here and then we'll get going. Got a couple people on and everybody's joining now. Okay. So I'm going to go ahead and get started. Like I said, I'm so excited to have you guys. I hope you're having an awesome day. And I hope your Thursday is the best ever. It is sunny outside. It's not too hot. It's a little chilly. When I go out later to walk the dog, I'm going to put my little jacket on and, you know, enjoy life. And I hope you're doing the same. I encourage everybody in this moment to truly just kind of almost close your eyes, take a deep breath, and know that everything is good, life is good, you're healthy, you're happy, and we're going to have an awesome day together, okay? So please always know that. Let the stress of the world just fall off your shoulders and you will be all right. And we're going to make this together, right? One thing I want to make sure you know, because everybody that's logged on here is either a student, a current student, or an alumni. If you are a current student, make sure you saw my email this morning. I am personally going to come on site the week of the 15th, and we're going to do our small group training with small groups, okay? So make sure you saw my groups. Email me if you plan to attend, and I'm going to be the one doing demonstrations and, you know, giving you the opportunity for a safe place to do hands-on during this time for at least the next 2 weeks beyond that date. Obviously, we're all still doing digital learning until that week. So anyway, make sure you email me so I can include you in and you'll be just fine. Okay, so the topic today is one of my absolute favorite ones. You'll see how excited I get about this because it affects so many of us. Some of you are men that are listening to this call, and that's great, but many of you are female. And, you know, we can all have different issues. I'm going to tell you right now, and I want you to look at this picture. If you see my shared screen, of course, our topic today is hormones and clinical skincare. So we're going to talk about the nuts and bolts of what the endocrine system is, okay? And what the glands are and how that works in regards to skincare. I'm going to be speaking off to the side. You know, of course, I'm going to reference the slides you see, but I'm going to be speaking from, you know, my different experiences and different things that I've experienced with clients and my own personal things. If you want to even email me about hormonal issues that you've had yourself, right? Because if you are over 30, okay, like me, you're going to deal with hormonal issues. And I'm going to tell you, it's not even for just the folks that are 30, 40, 50, 60 years old. You can have hormonal issues that really affect you as a teenager in your 20s, especially as women. We try to take all these different birth control medications and it might work for you, it might not. So you can't really promise someone. And of course, I'm speaking on behalf of physicians everywhere, but as a physician prescribing these medications to people, you can't promise them one way or another it's going to help with acne. You know, everybody's DNA is different. And I think that's the number one reason why younger females might get on the pill, for example, and it's not going to work for everybody. You can't really say one way or the other. So we're going to talk about why that is and answer those questions for you, amongst many other things. A lot of times, folks that come into your treatment room will have things like hormonal splotchy hyperpigmentation, and even, not even on just the face, but almost like a reddish splotchy hyperpigmentation on the neck for those with more fair skin types. Or, you know, with medium to dark skin tones, what can happen too is if you ever pick at anything on your face, you can hyperpigment or hypopigment even more so than probably ever before because your hormones are going crazy. So you also may have experienced cystic jawline acne as an adult. That's never fun. We're going to talk about where that comes from. We're also going to talk about how a lot of male pattern hair growth on the upper lip, chin, and sometimes chest affects so many women. So if you are someone that works in a laser center, works with a medical spa, you do laser hair removal, this will definitely affect you. And you'll be like, you know, hey, I've totally seen this in my client, those terminal dark hairs, thick, and you know, we really need to talk about that. We're going to talk about the consultation that goes along with that. I also want all of you waxers, all my little hair removal queens, because many of you love waxing. I need you to think ethically when it comes to facial hair on the upper lip and chin that is dark and coarse. You know, you don't want to continue to wax over terminal dark hair that you can identify as being hormonal, because it will grow back more in its place. And we'll talk about why that is, of course, as well. So I hope that got you thinking and got you excited. And we're going to get into the science of it, but we're going to always bring this back to why do we care about this as estheticians? Why does this mean anything to us at all? So if you'll look at this picture, then we'll move on. The endocrine glands, the only one missing here, and I don't know if my video is over that one word, but we've got the pineal gland, the pituitary, the thyroid. The one that's missing from this picture is the parathyroid back here, the thymus in your chest, the adrenal glands that sit on top of your kidneys, your pancreas, which is super important for digestion, folks, and then either, of course, if you're a female, your ovaries; if you're a male, your testes. So that is, in fact, 8 endocrine glands per gender. So we're going to talk about all 8, what that actually means, and why we should care about it. Okay, so let's look at this question here. What is the endocrine system? I'm going to read it and then we're going to talk about it. The endocrine system is a chemical messenger system consisting of hormones, the group of glands of an organism that secretes hormones directly into the circulatory system, which is through the bloodstream, right? Your circulatory system, to regulate the function of distant target organs, and the feedback loops, which modulate hormone release so that homeostasis is maintained, which just means like an even flow of your endocrine glands. Okay, so we're going to talk about endocrine versus exocrine coming up here in just a moment, but I just want you to remember, and almost visually speaking, this slide is the most important visually. All of those glands, guys, all of those, if you see my cursor, speak to one another. And I think that's just so key to remember. If you've ever had a thyroid issue, then you most likely could have another issue, right? With something else like your adrenal glands, your pancreas, or whatever the case may be. So those are things to think about. They all speak to one another. All right, let's read on this. What is an endocrine gland? Interestingly, as y'all know, when you were in high school, you most likely went through anatomy, right? Bones and muscles. You went and discussed chemistry, which is the table of elements, compounds, all that kind of stuff, atomic mass, all that. But the endocrine glands or endocrine system, you probably didn't really discuss that much. So those are things to think about there. And that's why we're learning this now, because it matters with your skin. The endocrine glands are glands of the endocrine system that secrete their products, hormones, directly into the blood rather than through a duct. Okay, the major glands of the endocrine system include the pineal gland, pituitary, pancreas, ovaries, testes. We said all these things: thyroid, parathyroid, hypothalamus. Forgot about that one. That's another one. And the adrenal glands. The hypothalamus and pituitary gland are neuroendocrine organs. So, of course, in your head. Okay, so look at what it says there. It secretes products, which are hormones, directly into the bloodstream. So if you think of your exocrine glands, which secrete saliva and sweat and oil, we can see that, right? If you can imagine that happening inside of your body, that makes sense why it would talk to one another. It's secreting through the circulatory system and going to other glands, other endocrine glands, okay? So exo means out, right? Exocrine glands are glands that produce and secrete substances onto an epithelial surface by way of a duct. Examples of exocrine glands include sweat, your salivary glands, mammary glands, lacrimal, sebaceous, mucus. Exocrine glands are one of the 2 types of glands in the human body, the other being endocrine glands, which secrete their products directly into the bloodstream. So listen up. Y'all don't have to memorize all this stuff. I want you you just to take some of the basic things that are being said here and just, kind of hang on to that. So we said endo means inner, exo means outer. So if you can always remember, your endocrine glands are the ones that create all these hormone issues, or hopefully healthy hormone homeostasis. Your exocrine glands mean out. So it's going to be your sweat glands, salivary glands, sebaceous glands, which are your oil glands, things that you can see. We as estheticians deal with what exocrine gland? It's the sebaceous glands, right? We're always dealing with the sebaceous glands, whether people are very oily or very dry. Somebody may secrete too much oil, which means their sebaceous glands are kind of turned on overload. That is within their DNA. Whereas if you are more naturally drier skinned, your sebaceous glands are probably not producing enough oil, and that can be very DNA specific too. So these are some good vocabulary words for you guys for State Board. If you'll look at this, write it down. Of course, please rewatch the recording of this one. The endocrine glands versus exocrine glands, okay? These are going to be your exocrine glands. Sebaceous glands, meaning oil glands, and your sudoriferous glands, meaning sweat glands. So Lord have mercy, that's a lot of mouthful of words, right? Sebaceous, oil glands, sudoriferous, sweat glands. That will totally be on State Board. Make sure you know that one. Okay, so before I get into all this, I will tell you, this is so neat to me, and I want to teach you what these glands are and make it a fun thing for sure, because I know how it is when you're reading something and you're like, oh, well, how does this actually go with what I care about? I'm in the beauty industry. What does this matter to me? Let me tell you something. When you are seeing a client and you cannot figure out what is going on, you will need to kind of hone in on some of those back end items like health. And we can't diagnose, but we can suggest, we can come up with a hypothesis. And many of you have heard this story I'm about to tell, but for my new students listening, you have not. And I will tell you, this could have been hormone related, but it was kind of slightly not hormone related. So before we talk about the pituitary gland, I will tell you a story, and this always goes into infection control too. So here's what it was. I had a student one time, and it was when we first brought the school to the Columbia area. So I've had the school since 2012, brought it to Columbia in 2014 from Sumter. And she was in one of my first classes as we were getting rolling and, in the Vista. So she comes in, she's this gorgeous supermodel. I want to say that she had traveled around the world modeling. She was a fitness instructor as well. And she would come in and bring her fiance at the time to the clinic. And we would do a ton of back facials on this guy and did a lot of extractions. And y'all know me, I love extractions, right? So we were extracting away. The students were happy. All is good. It was fun. It was funny. I mean, it was interesting. So I pulled her off to the side though, after he had come 2 or 3 times. And I said, listen up, because that look of someone that is taking black market steroids, right? For muscles, and they kind of have a smaller head, but they have big muscles, right? This was this guy, okay? They're both in the fitness world, so that kind of makes sense. So I said, well, please tell me, we'll call her Susie. I call all my little fictitious people Susie. I said, Susie, if you need to just tell me something, can you please tell me if he's taking any steroids or anything for bodybuilding, weightlifting, because I need to know. I need to know, because that is a huge sign that he is taking it to get tons of body acne. And my fear is we're going to cause more harm than good by continuing to extract little pores in his back that are going to just fill up again. And it could eventually cause a bacteria infection or something like that. She said, well, no, Miss Courtney, that's not happening. He's not doing that. I said, okay. So as the weeks went on, she, gorgeous thing, comes into the school, and all of a sudden she's starting to have some really serious cystic acne in her mid-face. And that is very, very, very unusual, because, if it's hormonal at all, it's usually going to be cystic jawline acne. So, of course, she's using all the good products that I've recommended, clinical grade, right? She's gotten her student kit stuff at the very least, getting all the chemical peel things at the school. Of course, she's eating very healthy. I mean, she's working out all the time. So I said, well, Susie, because she's coming in crying, very upset about this. I said, Susie, make sure you go to Hawthorne's Pharmacy. I usually suggest people go there. Of course, if you're in Columbia, that kind of makes sense to you. There are other compounding pharmacies out there, but I did tell her, I said, Susie, go to Hawthorne's Pharmacy and see if you can get the saliva test to test your hormones, get your thyroid tested, your adrenal glands tested, because they usually won't do that unless you ask, and see what your testosterone level is in your adrenal glands. I'm very curious. So she comes back and she did this, a couple weeks go by, and the test came back negative in terms of any issues, right? All her levels were correct. I said, okay, well, we'll try to figure out what else is going on, because it's usually an elevated level of testosterone in the adrenal glands. I'll talk about that when we get to that endocrine gland. So she starts coming back into the school, continuing to cry, really upset, just, obviously very just distraught. So I pulled her into the dispensary, shut the door, and I said, well, Susie, can you please be honest with me, because I have a just hypothesis about this, and then you can obviously go to a doctor and figure out if this is true. I said, if you can just do me a favor and tell me right now, is your fiance taking steroids? And she said, well, yes, he is. I said, okay. I said, are you having unprotected sex? Are you sleeping on his chest maybe at night where his, sweat is kind of touching your skin or whatever? She said, well, yes and yes. And I said, okay. I said, well, I want you to go and now get a blood test done with your doctor and see if you have steroids in your system. So what do you think the answer was when that test came back? It came back positive that she did. So I will tell you, that is always a great story to tell. If you've heard it before, listen, it's always a good one, because that really teaches you how you have to assume that all blood and bodily fluids are infectious, right? That has to do with not universal precautions, but standard precautions. Remember, the OSHA, Occupational Safety and Health Administration, they put into place standard precautions in 1996. Before 1996, which is shockingly not that long ago, they assumed that some, but not all, bodily fluids are infectious. They assumed that sweat, breast milk, semen, whatever, it was not considered infectious. I mean, how ridiculous is that? Of course it is. In this situation, it totally was. So nonetheless, that was kind of an odd situation. We'll talk about some other hormone specific issues, but that is just a good way to start this lecture, because you are kind of that person that gets to know your clients, right? You're going to help them figure out things that are going on with them personally, and we can never diagnose. But I will tell you, if I think someone has a skin cancer on their body, I will say, listen, I'm concerned about this lesion. I really want to help you go to the professional, the physician, make sure we decide what it is, and that'll make me feel better. You'll be healthy. I'll be happy. All is good. And I've done that with people before. I had this client, Cindy, oh my goodness, instructor, she used to come to me for facials all the time. And she had this little lesion on her back. She would just cover it with a Band-Aid. And I said, Cindy, you cannot do that, because I could tell it was at least cancerous to some degree, and definitely, and maybe not malignant melanoma, but I want to say it was at least basal cell. So I drove her to a plastic surgeon that I knew, him and his wife, and Sumter at the time. I think they've moved to Texas since then, but she did the Mohs surgery, which removes all of it very strategically. And then of course, plastic surgeons can make it look like there was no issue there at all. Some physicians will leave big scars, when you get things done. But anyway, we're here to help people. That's really what this is all about. That's why you're here. That's why you're learning aesthetics. We're here to help people. We care about people beyond just them spending dollars with us to get their skin treated, right? We care about their health. Okay, so I hope that gets you excited. So the pituitary, we're going to start from the head down, okay? Let's read what it says. The pituitary gland, located at the base of the brain, secretes trophic hormones. Write that down. This is going to be on a test you take eventually at the school, okay? Otherwise, you may have already taken this test. But trophic hormones cause other glands to make hormones. That's all the pituitary gland does, guys. I'm going to read the rest, and then we'll just simplify it for your notes. The pituitary gland is the command center, so to speak, of the endocrine system. Command center, just like our brain, it's the brain of the operation. Several important trophic hormones are secreted from the pituitary pituitary gland and make their way to the ovaries all the way down there, which are both extremely important for ovulation and childbirth. What we're fixing to talk about is something called luteinizing hormone, a follicle stimulating hormone that are secreted from the pituitary. And yes, it affects you, because if you've ever had a cycle, right, as a woman, sorry for any men listening to this lecture, if you've ever had a cycle as a female, you have experienced this release, okay, of LH and FSH from the pituitary gland that goes down to your ovaries to pretty much plant the egg, and then the other one releases the egg. So if you don't have an even distribution of one or the other, guys, then you're going to have something called ovarian cysts. If you have ever had that, you know how painful it is. And what happens is one of them secretes the luteinizing hormone, which then creates kind of an air pocket. But once the egg goes in there, I mean, it's in there, then it's released. But if the egg does not go in there correctly and it's just an air pocket, the air pocket can then rupture and burst. And that's really the worst feeling. And I've never experienced it, but I know enough about it to know that women everywhere deal with this. And, you know, there's medications that can, of course, treat that. There's other things you can do. But worst case scenario, you will get something called polycystic ovarian syndrome, which we will discuss here momentarily. So as a review, look at what it says. The pituitary gland, remember, it is the brain of the operation, the command center, so to speak. All it does, guys, is secrete trophic hormones, which all that is a hormone that causes other glands to make hormones. Thank goodness we want it to work. So let's talk about what else is done here. So we said this a minute ago. Follicle stimulating hormone, also known as FSH, okay, is secreted by the pituitary and essentially plants the seeds involved in ovulation during puberty and beyond. Luteinizing hormone, also known as LH, is another very important trophic hormone that's needed to actually release the egg from the ovum in order to have children. So for those of you that have had kids, you can kind of see where this has happened. All is good. For those of you that may be experiencing PCOS, or I will tell you my personal opinion on that is that a lot of folks are actually pretty misdiagnosed with PCOS. A lot of the symptoms of polycystic ovarian syndrome are the same thing as some adrenal gland disorders that we're going to talk about. So for a physician to tell you that you just cannot have children because he's diagnosed you with PCOS, that's a pretty heavy thing to say to somebody. I would get a second opinion about that one. Make sure they're testing for your adrenal glands. The problem with obstetricians is they only treat one endocrine gland. Your OB doctor, they only treat your ovaries, right? So unfortunately, they're not endocrinologists, and you have to be referred to go to an endocrinologist. Isn't that crazy? So you might completely be overlooking, or the physician might be completely overlooking what's actually going on. It could just very well be your adrenal gland. So definitely ask me some questions on this if you have any. I love this. And once everything is back to normal here at Southeastern Aesthetics Institute, I really want to take you guys to one of my favorite places. I had my blood panel work done just to see at one point, I'll tell you that story coming up, from Carolina Hormone and Health over in West Columbia. They have a couple of different locations. One's in Charleston, if anybody lives there. Some of our students do. But I can definitely give you that information if you're interested in getting some work done to know your levels. That's kind of neat. So Carolina Hormone and Health, we'll go on a field trip for that one sometime this summer. Okay, so make sure you write that down. FSH plants the seed. LH, luteinizing hormone, actually releases the egg from the ovaries, okay? So all important stuff. This is what happens from the pituitary gland all the way down to our ovaries, okay? Then we kind of talked about this in some other slideshows this week, but I will say this again. Because the pituitary gland back here secretes MSH, everybody say to yourself, melanocyte stimulating hormone, okay? As estheticians, we sound very smart, right? When we say all these long words like glycosaminoglycans and, you know, oligopeptide 7, tetrapeptide 5, all these interesting things. But melanocyte stimulating hormone It secretes it from its intermediate lobe, and it's exceptionally important for estheticians to understand the connection with the possible loss or disconnection, rather, of any trophic hormones that actually need to occur in females. If any trophic hormone released by the pituitary are not functioning properly, or sometimes not at all due to genetic predispositions or health issues, the skin can be a target to overstimulation, look at what it says there, of melanocytes or hyperpigmentation. Remember melanocyte, cyte, C-Y-T-E means cell, melano means melanin. So what is a melanocyte? It is a pigment cell. Okay, so the pituitary can secrete melanocyte stimulating hormone, guys, when your hormones are out of whack. That's basically what it's saying. So how does this relate to aesthetics? If you have someone on your table that has that very, I need to add this into a slideshow so y'all can have a visual, but that splotchy hyperpigmentation, not just freckles from the sun, right? It just almost looks like paint splatter in certain areas of the face. I've actually treated tons of this, and medium to dark skin tones, you have to be very careful with how aggressive you are with that sort of skin, Fitzpatrick-wise. But one of my very good clients, Christine, who I've treated for years, she is a stunning woman, by the way, but she's probably a Fitzpatrick 5, so she is got a darker skin tone, but she ended up getting in her 50s, and she works out, eats right, all this kind of stuff, but it's just probably predisposition, it's genetic in her DNA. She ended up getting this whole big old hormonal hyperpigmentation on her forehead. It took us 12 months to clear that, okay? Because we wanted to be very specific. She's also a type of person that cannot get, for example, eyebrow waxing done in the same session as a facial, because she would just swell up. So you will have clients that are very sensitive skin, and you have to space out their sessions, okay? And you don't want to ever promise somebody overnight results, because you know that's what everybody wants, right? But while we say in general 6 to 8 treatments are going to really help most people, it will, but for her it was more like 8 to 10 sessions over the span of 12 months. And she still comes to see me, guys, because once you treat someone for hyperpigmentation, they'll never go to anybody else. I'm gonna tell you right now, especially hormone related hyperpigmentation, that's tough to treat, really tough. So nonetheless, just make sure you understand that the pituitary gland can secrete melanocyte stimulating hormone when hormones are out of whack, and that is a fact. So when you help clients figure this out, you can kind of deduce that, listen, we need to go get some hormones checked, and we'll talk about what you would say, right, in just a minute. All right, the thyroid gland right here in the neck. Many people either have had thyroid issues or know someone that has. This is very prevalent, unfortunately, but let's read about it. It's the hormone, it says hormones secreted by the pituitary gland help control metabolism, or it's supposed to say thyroid, I'm so sorry, that's a typo. Help control growth and metabolism, which is the job of the thyroid gland, located in the neck and consisting of 2 lobes. The primary influence of the thyroid is the regulation of the body's metabolic rate or energy levels. I don't know about y'all, but I need lots of energy every day, along with the body's capacity to synthesize protein. How important is protein? Did we not talk about this yesterday with the cells? We said ribosomes, which are organelles within a cell. Okay, ribosomes make proteins, and proteins are truly what help create overall health in your body. We also said that 3 things are needed to help cells create proteins, which are food, nutrition from plants and, fruits, of course, some meat, okay, oxygen and water. You need that. But look at the thyroid. It helps also to synthesize protein. So if you create all this protein through your cells, guys, but then you can't synthesize it, meaning to use it to actually help your body be functional and healthy, then it's really all for nothing. So we want to take care of our thyroid too. This is a whole lot to take care of, right? All of a sudden health means a whole lot more to us as we start getting older and people are counting on us. We want to make sure to take care of our bodies. So then it goes on to say the thyroid must function in its most healthiest state, and it produces the hormone calcitonin, which plays a large role in calcium homeostasis. Calcium is very important for our bone health and other roles, as you know, right? Calcium. But do you need to eat a lot of cheese and dairy to have calcium levels at its optimum level? No. Oftentimes, if you overdo it, we talked about that yesterday a little bit with, hormone stuff with dairy, and I'll talk about it further right this minute. But worst case scenario, with excessive calcium in your body is kidney stones. Remember, kidney stones are made up of calcium deposits, which harden. Okay. If y'all have ever seen Amelia on the face, that's a hardened ball of oil, and we have to kind of nick it with a little lancet and then scoot it out. Same thing. It's a hardened ball of calcium from people that eat too much dairy, or people that potentially have a thyroid issue where your calcium doesn't really function correctly and kind of assist your body the way it needs to. It could just kind of all congeal into one little area. And then you have these issues. And let me tell you something, my dad had kidney stones, and I know just by watching him deal with that, how painful it has to be. If somebody's had a kidney stone, please email me and I'll chat with you about this one later, because gosh, it's not fun. You either have to let it pass, or you have to go in laparoscopically and have it broken down in order to then pass it through your system. So nonetheless, all right, let's talk quickly before we move on about dairy. Let's say that you're a cheese lover, which I am. I really try my best. I really try to stop it. It's very difficult. I could never just not eat cheese, right? We're from the South. I like my barbecue. I like my cheese casseroles. So anyway, we're going to try to do better. But let's say that this is your gut, okay? This is where your digestive tract is located, between my hands right here. And you are trying to get, your broccoli, your fruits and vegetables, all the nutrients from that in here to help digest your food, help your pancreas to create digestive enzymes, help things pass through easily, get rid of internal inflammation, all that good stuff. So when you eat and drink a lot of dairy, what will happen? I mean, think of what milk is. It's really lactose, which is lactic acid. And we know lactic acid for skin stuff. It exfoliates yet hydrates. That's always been my definition. Remember, by hydration, I mean it leaves behind a little film on your skin. That is totally what lactic acid does. So I always say you're going to love lactic acid because it just feels great, like after you've done it. But overusing lactic acid is not a good thing either, because it just leaves behind a little film, leaves behind a little film, leaves behind a little film, So does that make sense now? I hope it does, because I'm sure you're a lactic acid lover like I am. But when you overdo it with lactose, any kind of milk-based product, what happens is it's going to build up this kind of lining on top of your cells in that area, which would be your digestive tract, okay? And what will happen is, let's say broccoli, your fruits, your vegetables that are trying to get past this lining, it's not gonna at all. So what you hope happens here is that your pancreas comes into play, because your pancreas is supposed to secrete something called digestive enzymes. And let's pretend that we have little Pac-Men, right? I always say Pac-Men, kind of eating away dirt and debris. So we hope that the Pac-Men are going to eat away all this lactose, glucose, kind of very gooky, thick lining, and it's going to go away. So then we can get the penetration of those ingredients, that nutrition that we need. However, if you've already created that lactose lining in your gut, unfortunately, as we've already said, all this kind of stuff really speaks to one another. So sadly, your pancreas can truly stop secreting digestive enzymes. So maybe it's trying to get there, but then maybe it just stops. Okay, so what you will then do, because your pancreas is now not working properly, that sucks. So we are going to suggest some supplementation. Okay, supplementation, as many of you do know, is not regulated necessarily by the FDA. So you have to be careful about prescribing anything, but especially supplementation. We want to recommend, go to places such as Whole Foods, Garner's Natural Life, very nice holistic places that you would purchase supplements from. You can take a supplement called digestive enzymes. Okay, so let's say we're taking digestive enzymes, and it's going to help produce some internal digestive enzymes because our pancreas is not secreting them. So now we can start eating away at that inner lining, guys, and it's gone. But I will tell you what would have to happen there to make that happen, just kind of like I showed it, would be to stop the dairy and or cut back majorly and take digestive enzyme supplements on a regular basis. I have some recommendations on that. If you will actually look up the website today, Renew Life. Renew Life is the name of the company. I have loved that company for years. RENEWLIFE, renewlife.com. They specialize in digestive enzymes and probiotics. Okay. Love that, because most companies try to do a bunch of everything, but they specifically specialize in digestive enzyme supplements and probiotic supplements. So we know digestive enzyme supplements help to break down food, and which is a good thing for everybody in many ways, for stomach issues, but also for your health of your skin and just overall health. But then probiotics help to increase your level of good bacteria. Remember, you have to have pathogenic and non-pathogenic bacteria. We don't want pathogenic bacteria, that's harmful, but we need to have non-pathogenic bacteria in our bodies, which is harmless. So remember, when you take something like an antibiotic, what happens there? It takes away all your bacteria, good and bad. So you end up as a female having things like a urinary tract infection from taking antibiotics. So just make sure that makes sense to you. We want to recommend, if we're talking about health and wellness to our clients, we want to recommend digestive enzymes, specifically help with hormones, by the way. And then probiotics build up a good immune system. If you have a good immune system, I'll tell you, almost selfishly for estheticians, that will help you get to a place better with a client when I don't have to worry so much about how they heal from a laser treatment or a chemical peel, because they're taking probiotics. I start to feel a lot better about that, right? Okay, so remember, all this kind of ties in together. Make sure you write down all this good information about the thyroid, but we want this to be functioning properly, because long story short, if you're just writing a couple things, I would say the thyroid gland is located in the neck, and it helps with metabolism and energy, but it also helps to play a large role in how we process calcium in our bodies, which is essential for many, many things, one of which is bone health. Okay, then interesting ways to keep the thyroid functioning properly are to watch the body's iodine and tyrosine levels. Okay, many people don't even think about iodine, but you can get iodine by eating a lot of very fresh fish. Wild salmon is a great option there, or just, caught from the wild, nothing that's, actually, how did they do that with fish? Do they put them in little pools and then they just kind of breed them that way? That does happen. So we don't want that, as they play a direct role in the health of T3 and T4, okay? Hormones secreted by the thyroid. It has been found that radioactive isotopes of iodine can actually be used to treat thyroid cancer. So for those that deal with the health industry, you may have seen this. A lot of physicians are doing that these days. They're taking radioactive isotopes of iodine to treat thyroid cancer. So when you go for those health screenings and you go to those places like Carolina Hormone and Health, you can actually see and ask for a test of your iodine levels to see if your thyroid is healthy. That's a great thing. So I think it's a little bit of a typo there, but T3 is triiodothyronine, and then T4 is thyroxine. Okay, I'm not expecting y'all to remember those long words, but make sure you know T3 and T4, which is supposed to be at a certain level for your thyroid to be healthy, long story short. Okay, so many of you have heard of hyper and hypothyroidism, and I have actually seen somebody write Hashimoto's on their intake form, for example, and they didn't even know what it meant. So make sure when people do write down any kind of predispositioned health concerns, or if they write down or discuss this with you on their intake forms, that you kind of have a good understanding of what it is, because they might not actually. So just make sure you're good to go there. So let's read what it says. Hyperthyroidism occurs when the thyroid produces excess amounts of its hormones. Graves' disease is a cause of hyperthyroidism. So basically, hyperthyroidism, hyper means excessive. Okay. Graves' disease is the same thing as hyperthyroidism. So just make sure you know that those are interchangeable. Symptoms include eye bulging, fast heartbeat, weight loss, poor tolerance of heat, irritability, and moodiness. Myxedema is a term you probably should know. That is actually a skin condition, where the skin becomes dark on the shins, usually in a thick red, brown, bumpy texture, okay? And sleeping problems. So just make sure you're good to go there. Hypothyroidism is most often caused by Hashimoto's thyroiditis. So if you hear of Hashimoto's or see that on an intake form, it is in fact hypothyroidism, which means less, okay? Hyper, excessive, hypo, less. Is another autoimmune disease in which the thyroid lacks sufficient amounts of its hormone and can cause nodules and or cancer to develop. Oftentimes people will have more of the hypothyroidism, sadly, because they're lacking the thyroid hormones needed to have a healthy thyroid, and that will cause nodules or cancer to develop, okay? One thing I did want to say about that one, I've seen this firsthand, okay? So hypothyroidism is going to be, of course, the opposite of hyper. So they're going to have more of the weight gain and kind of the moon face look. And I had a client come in one time and I saw her name on my schedule. This was before I had the school. And I knew her in my head. I thought, well, oh gosh, you know, we went to school together. She was a couple years ahead of me, but I know who this is. And I was kind of excited to see her, you know. So she walks in the door and I just thought, well, that can't be the same girl that I'm thinking about. But actually it was. And I will tell you what happened to her, because we ended up chatting about it while I'm giving her a facial. She had been very teeny tiny in school, okay? But she ended up having major hypothyroid issues and really combated thyroid cancer and was on medications, but she very much ballooned up. And it's not like the same weight gain that you or I might experience. It was a different one in which she ended up having that moon face and just truly looked like an entirely different person. To me anyways, especially if you knew her then versus now, sort of thing. I was very shocked by that and I hated it for her, but that helped me treat her, and I'm glad we had that discussion. So she actually was a client of mine for a number of months, and it helped her feel so much better. She started to actually lose a little bit of weight due to the medication she was on, but can you imagine the heavy steroidal medications that you have to be on there? So I would be very concerned and question a lot of the things that I would do for her. I did not want to cause any more issues or any flare-ups due to chemical peels or choices that I would choose for her treatment, right? Okay, moving on to the pancreas. The pancreas is well known as the glandular organ of the endocrine system to regulate insulin and assist with digestion of nutrients in the body. So we know everything about, or at least in general information about diabetes, right? That's one thing we're going to discuss, but it's the digestive enzymes that we really want to make sure are working, because I promise you, people that have ever had heartburn or digestive issues, you most likely have an issue with your pancreas, even if you're not diabetic. So keep that in mind. The pancreas must function correctly in order for the correct enzymes to effectively break down carbohydrates, proteins, and lipids, which is critical for ridding the body of internal inflammation, guys, which can actually be a source of hormonal imbalances altogether. Of course, the most popular understanding of the pancreas has to do with its diseases type 1 and type 2 diabetes. So look at what it says there about correct enzymes kind of through the middle of that. It needs to, of course, correctly create enzymes to effectively break down carbohydrates, proteins, and lipids in order for your body to use them, okay? It gets rid of internal inflammation. You hear that a lot when you're focusing on health. And of course, people are talking about the fruit and kale smoothies, talking about intermittent fasting and all this kind of stuff. But it truly is not going to mean anything if you cannot focus in on your internal health to break down that food in order to then use it correctly. If it's not going to be used correctly, you're going to have a hard time losing weight. You're going to have a hard time gaining weight for some people that need that. You're going to have a hard time with your hormones. You're not going to feel good. I mean, when we are busy moms, busy wives, busy whatever, we want to make sure that we feel good. And I think that's what it all boils down to. Sometimes it's not just about being beautiful or, you know, looking great like our industry is all about. It's about feeling well. All right, so type 1 diabetes occurs typically as a childhood onset disease in which the pancreas does not produce insulin altogether as a birth defect. So plenty of us know people with type 1 diabetes, and they have it usually under control because they know that it's there. They've had it since childhood onset, and they regulate it, okay? So that's great. However, type 2 diabetes is a lifestyle alteration in which the individual throws their own insulin secretions into decline through proper eating habits. I was told, oh my goodness, I had all sorts of crazy things. I'm always prone to be sick closer to the beginning of the year. And I ended up having some different things go on, but I ended up going to the eye doctor to just get some new glasses because I have to wear glasses when I drive. I wear my glasses when I'm watching TV, that sort of thing. So I went, you know, to get my new prescription, and he's doing a test on me. He said, well, you know, do you have high blood pressure? You might want to go get tested for diabetes. And I said, oh my gosh, you know, it kind of scared me immediately. And of course I was very upset, and he had actually tested my blood pressure and it was high. But interestingly enough, and this will kind of give you some thought, if you guys are very allergy prone, which I am, be very, very careful. I've actually rethought this since I was told this information. Anybody that's ever taken Claritin D, anybody has ever taken Claritin D, I will take that every once in a while for my allergies. And I had taken it that day. I had gone to work all day and didn't eat anything or drink anything because I was slammed from just seeing clients and teaching and that sort of thing. And I had to literally run to my appointment. So wasn't even thinking that I had taken the Claritin D. Claritin D has Sudafed in it, which that actually increases your blood pressure. So no wonder I tested for that, but it scared me half to death. I would love to, after all this is said and done, go and do another health panel, make sure I'm not going to get diabetes, but some of you may have it, you know, and the thing about diabetes is it's good to know you can get yourself out of type 2 diabetes, FYI. I don't know if you've been told that or not. I can send y'all some good information on that. But look at what it says in underline there. Diabetes is a glucose metabolism disease characterized by chronic hyperglycemia, which means that there's excessive amounts of glucose circulating through the blood plasma. So remember, glucose is very sugar molecule specific, or if you eat a lot of carbohydrates that are not refined carbohydrates. So anything that's bread specific can then turn into a sugar molecule in your body. It's just almost like eating the same thing. So glucose and lactose to me are very similar. They have this very thick, kind of gooky, sticky lining. If you can imagine, sugar is very sticky, right? You want to think about how that will affect you overall, and that can be what causes your insulin not to be produced correctly in your pancreas. I will tell you this story too, and then we'll move on. My father is type 2 diabetic, and he is a retired engineer of ETV in Columbia. He was the VP of engineering there, and you know, they do the South Carolina Educational Television. So he's retired. He still goes back up there every once in a while and does some contract work because he just enjoys that. But he's pretty ill himself now in his later 60s. But anyway, he told me one day, I taught this class and so I took him to lunch one day. He just happened to be in Columbia, and we went to lunch. And I said, well, I'm teaching about, you know, the hormones system and diabetes and stuff. And he said, well, oh my gosh, I remember the exact moment I got diabetes. I said, what? What do you mean? You know the exact moment that you got diabetes. Who in the world says that? He said, well, he said, I know when it was because I was standing out on like a job site with a bunch of satellite dishes, you know, and he was doing some stuff out in the hot heat and they were trying to do something for a work related thing. But at the time he had been eating a lot of just kind of vending machine foods, going through the drive-through at McDonald's, you know, stuff like that, and drinking a lot of very high fructose corn syrup drinks, right? Like Coca-Cola, Pepsi, you name it, Mountain Dew, all that stuff, all the, you know, sodas. And he said, well, I remember I wasn't eating very healthy then, and I was standing out there in the hot heat, and all of a sudden, my vision went blurry immediately, just like that. And I knew something had just kind of shifted in my body. And he said, I went to the doctor the very next day, and they said, well, congratulations, you know, threw yourself into type 2 diabetes. So I don't know if any of you have diabetes or have experienced that sort of thing, because of course blurry vision can definitely be one of those symptoms. Also, you may know someone that has had diabetes, and you may have known or not known when you contracted it, but I just thought that was an interesting thing to add to some of my education, because you are causing that and we want to get away from that if possible. And it's okay if someone is diabetic. That's not a complete contraindication, right? But sometimes contraindications mean just be careful of. So I will tell you, if I see diabetes on my intake form for a client that has filled one out for my treatment room, I'll say, okay, well, no problem, glad to know it, but we're going to be very careful with the healing processes of chemical peels or a laser treatment or something. It's kind of just a red flag just to be careful of, and then that way you're good to go. Anybody with an immune system disorder of any kind, diabetes is one of those examples, you're going to have those as issues, okay? So those are things to think about just for the safety of your client. Okay, your adrenal glands, we're getting there, guys. I'm going to probably do about 20 more minutes if y'all can just hang tight. Okay, the adrenal glands, the understanding the adrenal glands is fascinating to the esthetician for many reasons. The adrenal glands look like little hats that sit on top of the kidneys and are made up of a medulla and a cortex, okay? The adrenal cortex produces 3 types of steroid hormones: mineralocorticoids, glucocorticoids, and androgens. Now, remember yesterday we said something about antigens. I always thought to myself when I teach students, I'm thinking, golly, I need to make sure that they understand the difference between antigens and androgens. Antigens are what prevent against foreign invaders or are foreign invaders. Then androgens are male pattern hormones. So just make sure that you understand the difference between, okay? Then it goes on to say, mineralocorticoids help to regulate blood pressure and electrolyte balance. A type of glucocorticoid is the popular cortisol, unfortunately, right? Which serves as our stress hormone. Who has super high cortisol levels right now? Everybody. Understanding and regulating excessive stress is important for the regulation of the adrenal glands, guys. So adrenal glands are probably my favorite out of all of them because they're the least really looked at. And there's so much that goes on here, so much. So just make sure you understand. If you ever thought, well, gee, I wonder if, you know, stress has something to do with me breaking out, I'm going to tell you absolutely. Absolutely. Your stress levels are high, then you're going to have an issue, because I'll tell you what else is in your adrenal glands. You've got not only your corticoids and all that actually help you with your fight or flight response, you know, in life, your cortisol, which is your stress hormone, but it also houses androgens. Hello, look at what it says, which are your natural source of testosterone. I thought that was the neatest thing because I did not know this previously. And when I really studied the endocrine system, and of course, now that I teach it, I just am so shocked to know that we have this particularly natural level of testosterone, which is a male hormone. As women, we have that. But it's kind of like a seesaw. So let me tell you something. When you have cortisol sitting on this chair right here and your androgen sitting on this chair right here, if cortisol is like, ooh, we have lots of stress today, hello, then it's going to literally make the androgens, the male pattern hormones, that testosterone, just kind of go crazy, right? And it's going to cause all that male pattern stuff. like cystic jawline acne, splotchy hormonal hyperpigmentation, and male pattern hair growth on the upper lip, chin, and sometimes chest. Seriously, think about your adrenal gland health. It is so important, not only for just your sanity, but your skin health. So big. Understanding and regulating excessive stress is important. That's what it says. The third steroid hormone, we said this, okay? Androgens are the female's only natural source of the male hormone testosterone, okay? This fact is important for many estheticians as high testosterone in females causes male pattern characteristics such as excessive hair growth on the chin and upper lip, hyperpigmentation, and cystic jawline acne. Very important to know. I don't want any of that stuff, right? The regulation of adrenal gland levels are imperative for proper skin health and can be a source of understanding for those treating acne or hormonal hyperpigmentation. Absolutely. Okay, so just make sure, and I know some of you are typing in a Q&A, and I apologize because it won't let me look at it for some reason. So just shoot me an email if you have any questions on this, okay? Adrenal glands are so key. The one other thing I'll say before I move on is you might do some reading about testosterone increase in your ovaries. That can happen, but it is a very unnatural place for testosterone to form. And it's not a natural thing. It's not a good thing. So this is your body's normal area where it would be. We just don't want to exacerbate this and make the levels go up too high. I had a teacher one time that worked for me in Sumter, and now she lives in another state, but love her to death, miss her so much. We talk about getting together often. And she, at the time, she's got gorgeous skin now for sure, but at the time, she was having the darndest awful time with just this really serious cystic acne. And she was a little bit older than I. And we tried to treat it. We tried to treat it. I paired up with Dr. What is his name? I can't think of it. Dr. Dent. He was a hormone specialist that has, and he probably still practices. He's got a couple offices around South Carolina. He had one in Sumter. And so I had him in a couple of times at the Sumter School to do some talking and speaking little engagements for the students. And I had actually taken her, the teacher, with me to an appointment to see him just to get some testing done for myself and to just chat with him about some upcoming education I wanted him to do with the students. And so she came and we actually tested her testosterone levels, and her testosterone was through the roof. Once he put her on hormone replacement therapy, she was fine and her skin completely cleared up. But I'm telling you, there's a whole lot that we can't fix because we're not physicians, but we need to be able to steer them in that direction and pair up with people that do this kind of stuff. And if you are wondering, well, I don't live in Columbia, or I don't live in Sumter, or I live way over here, let me help you with some thoughts about who to send your clients to, because that is a great way to pair up and kind of cross promote to each other's clients or patients, but also just to truly be a helpful person. So we want to make sure we help those clients. Okay. Then the medulla of the adrenal glands produces adrenaline and non-adrenaline, producing the fight or flight response in the body during intense situations. So if you've ever been in a car and you had to slam on brakes because somebody just stopped in front of you, I'm sure that's happened to y'all often, you literally feel like that fight or flight response has just kind of been jolted in your body, and you kind of have to calm down from it a little bit. I'm sure you've experienced that in many ways when something just kind of panics you or freaks you out. That is a normal response. It's a good thing that it happens, but your adrenal glands are part of that. Then let's talk real quick about Cushing's syndrome and Addison's disease. So clients with Cushing's syndrome deal with many visual characteristics, okay, such as abnormal obesity, but with thin arms and legs, reddish stretch marks, a round red face, weak muscles and bones, acne, fragile skin that heals poorly. Please don't think any of you have any of this stuff. I know when you read things like this, you're thinking, well, gee, I wonder if I've got one of these things. Individuals dealing with Cushing's syndrome deal with high blood pressure, chronic fatigue, moodiness, and headaches. So again, pay attention to your adrenal glands. Sometimes people don't even know what is going on with their body. This could be it. Cushing's syndrome is caused by excessive cortisol-like medications. Look at that right there. Cortisol-like medications such as prednisone, which is, I have taken prednisone when I had, I had pink eye earlier this year, which was awful. and it was very swollen. They put me on a steroid, and it was prednisone. Of course, it helped very quickly, but you don't want to be on excessive cortisol-like medications. If you can imagine that thyroid issue we talked about earlier, people might be prescribed on those prescription prednisones for long periods of time, and that could cause you to then have Cushing's disease or Cushing syndrome, okay? Or a tumor that produces excessive cortisol by the adrenal glands. So it's either going to be naturally based by your adrenal glands having a tumor that produces excessive cortisol, or could be produced by excessive cortisol-like medications. Okay, so just remember that one. Cushing syndrome is really where the adrenal gland is producing too much cortisol, so that's not good. On the flip side, Addison's disease is the opposite. It's where the adrenal glands do not produce enough steroid hormones. So you have to have the right amount. So look at the aesthetic characteristics here. It includes darkening of the skin, especially in sites of friction, like underarms or something, vermilion border over the lips, genital skin, and other areas, muscle weakness, lightheadedness, sweating, changes in moods, and cravings for salt due to low sodium are other symptoms. Because hyperpigmentation can be one of the most rewarding yet difficult skin conditions to treat, it's important for the esthetician to take Addison's disease into account when treating skin darkening. Okay, I've seen that a decent amount. Okay, that is a big one. So make sure that you are aware of what Addison's disease is. It's the adrenal glands not producing enough steroid hormones. Okay, then these are some disorders otherwise. Okay, so Cushing's disease and Addison's disease, those are specific to the adrenal glands. Now we're going to talk specifically about polycystic ovarian syndrome, which is the lack of FSH and LH secreting from the pituitary up here. Okay, so just make sure you understand that. So here's a good vocabulary term for you. Polycystic ovarian syndrome is characterized by, everybody say, Hirschism. That's how you pronounce that word there. Hirschism, which is excessive body and facial hair from, of course my nose is itching, I'm sorry, from hormonal fluctuations. So remember, hair growth, there's two different types of hair growth, okay? Or excessive hair growth rather. Hirschism is excessive hair growth from hormones. Then hypertrichosis is just excessive hair growth, period, okay? That would come from, you know, like a genetic background where your hair is just longer and thicker in certain areas of the body where it wouldn't normally grow terminal hair, or people that have werewolf syndrome where you have the long, thick terminal hair, kind of, if you've seen pictures of that on the back of the spine, maybe they have a lot of hair growing out from their spine area on their back. It can happen. You know, anything can really happen when it comes to the human body, but just make sure you know that you can treat hypertrichosis with laser hair removal easily because it's not hormone induced. However, if you're doing laser hair removal for Hirschism, you want to make sure to have this discussion. And here's how I would start it. We're not going to, you know, of course, diagnose you, Susie Q, with anything, but I will tell you if this is right here, hormonal, that's called Hirschism. It is one of those things where it's hormone induced, which is out of my scope. And I'm going to refer you to someone that can get your hormones checked. And that way, you know what's going on. We can treat it from the root of the problem. But I will feel a lot more comfortable starting laser hair removal on you, Susie, if you get that under control for me and start taking some hormone replacement therapy. And then we can actually treat you with some really good outcomes. Because what's going to happen if you don't get the hormone issue under control, Susie, is you're going to have hair growth in other places. So we may end up treating the hair here, but maybe in the hair follicle right next to it, you could get a big terminal hair that comes out of that. And I don't want you to misunderstand that I have treated you, what you came in with from the beginning, but more can come up. Does that make sense? Shoot me some questions if that doesn't make any sense. But seriously, consultation is so key when it comes to aesthetics. It's not even funny. You have to kind of outline everything that they could possibly ask you before they even ask it, So keep that in mind. Okay, so moving on here. PCOS is rooted in the non-secretion or unbalanced secretion of FSH and LH from the pituitary gland, which are crucial for the ovaries to properly function in females. So true. We said that in the beginning. When the ovaries are unable to ovulate properly, ovarian cysts can occur, most certainly. And listen, just because you have an ovarian cyst doesn't necessarily mean, guys, that you have full-blown polycystic ovarian syndrome, okay? Just by the way. Then, due to and in conjunction with cysts, an unnatural, this is what I was saying a minute ago, an unnatural occurrence of androgens, that testosterone, can appear in the ovaries for females. That's when it turns into full-on PCOS, okay? And people can test for that if they do this correctly. High androgen levels are the source of the male pattern characteristics such as excessive hair, acne, and hyperpigmentation, right? So keep that in mind. This can totally be misdiagnosed. Of course, paired with this would be the assumption that that person can never have children. And I think that is such a horrible thing to say if that could essentially not be the case. And I say that because I've known people and I've known alumni of mine that have been told they have PCOS and they end up having children. And I'm going to tell you right now, I think they were misdiagnosed and it could have been truly an adrenal gland dysfunction all along. You know, they're very similar with how some of those characteristics actually show up. Okay, we're getting to the end, promise. So hormone replacement therapy, guys, that is very interesting. If you can imagine, and I can either send you places or we can field trip it over the summertime, but listen, natural hormone replacement therapy is an alternative to medicinal supplementation, which can have adverse reactions on negative side effects. HRT is any form of therapy using naturally occurring hormones such as progesterone and estrogen for females to supplement areas in which the individual is low. Okay, so that's great. So make sure you know that you can, of course, obtain this typically from compounding pharmacies. Usually they'll put people on progesterone because most women are estrogen dominant anyways, because we eat a lot of soy-based products. We drink and eat out of plastic items that usually are around heat. If anybody, and sadly enough, look at what I got here, a plastic bottle. Do you know how this got to the store that I bought it from? It got to the store in a hot truck. And heat is going to take all the BPA from this plastic bottle and just make it go into this water that I've been drinking. Isn't that awful? So we want to make sure that we're drinking out of glass containers when possible, making sure we think about hormones, just things we're doing every day that cause our estrogen to escalate. That's not good. And I'll say one more story before we quickly move on for the review, and then we'll be done. Okay, so last year, I don't even know what year it is, 2020. Last year, at the beginning of last year, we thought we wanted to have another baby. So what happened was I have always had an IUD in, okay, too much information, I know, but oh well, I'm sure some of you have one too. And so I said, okay, we're going to have another baby. I took the IUD out with the help of my physician, of course, my OBGYN. Took it out and I said, okay, we're going to try to have another baby. Well, I forgot that in my DNA pattern, my mother had this issue. I'm sure her mother had this issue too. When she turned 32 years old, okay, she had issues with hormones. But remember that hormone stuff, I mean, this is still brand new that people are even talking about it. Back in the day, they would assume that women were just depressed. So I remember my mother being on antidepressants, and truly it was about her hormones not being correctly. So did she need to be on antidepressants at all? Probably not. That wasn't even a thing then, natural hormone replacement therapy. So nonetheless, in my DNA, in my family, in the mid 30s, you know, you kind of have this very serious flow of hormones anyway, where it's just going to be this odd imbalance. So I forgot about that. And I'm going to tell you, you know, if anybody's ever had an IUD, you know that synthetic hormones that are being implanted into your body, which is fine for some, not fine for others. Some people cannot deal with IUDs or birth control at all, right? And I would love your feedback on this. Shoot me an email. But so what happened for me is as soon as I took the IUD out, it completely made tons of hormones just go rushing where it needed to go. But I ended up feeling so weird. I thought something's going on with my body. I can't really put my finger on it. This is not good. This is not good. This is not good. That's when I went to Carolina Hormone and Health. Okay. And I went, I said, I need y'all to test me for what's going on. You know, I think we want to have kids, but I'm not really sure if I, you know, of course I've decided not to. I've got 2 beautiful children. So we're good. And y'all are my kids too. So I'm fine. And I play with all the little babies in my neighborhood. But anyway, so I had my blood work done. And interestingly enough, what do you think my progesterone versus estrogen level was? Okay. And your ovaries, you're supposed to have a certain level of both. Okay. My estrogen was somewhere up here, which was not great for sure. But my progesterone, guys, was 0. That is really, really, really bad, because what can happen with that is if your progesterone is 0, then your estrogen can become super dominant to kind of take over for that lack of progesterone, and that can actually cause breast cancer. Okay, so I decided quickly, I said, well, I cannot have that. Clearly the IUD works for me. And in the midst of that, I had gotten put on a progesterone pill. So instead of kind of like a topical progesterone compound, I was on a progesterone pill for a couple of weeks until they could get the IUD back in, because of course they have to special order that and then insert it and that sort of thing. But I didn't really like the progesterone pill. I felt my ovaries kind of almost in pain. It was too much progesterone, if that makes sense. So as soon as I got the IUD back in, guys, within days, I was perfectly fine. And now my levels are normal. So that's a great story to say that some of you may have had great, outcomes from having birth control, and some of you may have not. I remember, gosh, a lot of people, I've heard of people having to lay on the floor, they're having hot flashes as soon as they started taking a medication like that. Hormones can really wreak havoc for women everywhere. So I kind of feel for you, right? We're always going through something, especially once you'll get into your 30s, you will notice life ain't easy. Very difficult when it comes to your energy levels and how you feel, Okay, so then it goes on to say natural estrogen or progesterone therapy can often be compounded, we said, at local pharmacies specializing in that specification. And this is just an overview. So there's 2 things I want to say, and then I'll end. But we did say and talk about the pituitary, okay? That one's the master gland, produces trophic hormones. We have yet to talk about the pineal glands. I just want to talk about this one. This one is a small endocrine gland in the brain, produces melatonin, if you've ever heard of that. It's a serotonin-derived hormone which modulates sleep patterns in both circadian and seasonal cycles. The shape and size of the gland resembles a pine cone. That's in the head as well. So you've got the pituitary, and then you've got the pineal gland, regulates your body's response to light, guys. Your melatonin is important. Some of you may take a melatonin supplement to get some sleep at night. So that needs to, of course, function properly too. Okay. Then the thyroid gland, we discussed that one, right? That was going to help with our energy levels, metabolism, also with calcium homeostasis. But here's what specifically helps with calcium, the parathyroid. So it's kind of one and the same, but also separate. The thyroid gland is here, and then the parathyroid is kind of towards the back of the neck. So the parathyroid gland consists of 4 tiny glands located in the neck that controls the body's calcium level. So those are slightly one and the same, but a little different. So just make sure you recognize that. This one is so important to me too. The thymus in your chest cavity. It produces T cells, okay, for the immune system. That is a good thing. You want your body to produce T cells. It becomes much smaller at the approach of puberty. So what they say about the thymus gland is it grows and shrinks in later years. So we want the thymus to work, and there is a disorder that I need to look up regarding this, in which a child may not have produced enough T cells. And I promise you, I'm sure it has to do with the thymus not producing that at an early age, and then they're going to have a bunch of health issues, right? So just make sure that that makes sense to you with the thymus gland. It's not something you're going to deal with for a long time as an adult, but it grows and shrinks in later years. It produces your T cells, which fight foreign invaders. Our body does this. And in fact, if you ever had an infant baby that you put in daycare for the first time, what usually happens? They get an ear infection. I promise you that happened to my son. And they have to build their body's response to the environment they're in. They're brand new people, right? So that's when the thymus kind of comes into play. It produces T cells that become immune to certain things around them, and then all is good. But in the beginning, it's a little rough, right? Then we said the pancreas is going to assist with our body's digestive enzymes and insulin levels. It is so important for digestion, just the way you process your food, which feeds our cells, right? Our adrenal glands sit on top of the kidneys like little hats. They produce our cortisol levels, mineralocorticoids, glucocorticoids, but they also house our body's natural level of testosterone, which is also known as a androgen, male pattern hormones, right? Then the ovaries or testes, that's important. For women, we need to have estrogen and progesterone. Super duper important. For men, of course, they're going to have testosterone. And then it goes into actual test questions, which we're not going to worry about right this minute. So I will just say this. I love you guys very much. If you have any questions, do not hesitate to email me. And in fact, if you're here for clock hours today, if you'll do me a favor, make sure you email me at info@seaestheticsinstitute.com with 3 things you learned today. Also, make sure if you're an active student at Southeastern Aesthetics Institute that you email me also about coming on site in our small groups, okay, for April. We're going to make that happen, and I'm going to be your teacher, and we're going to do it, and it's going to be safe and sanitary and fun. So I love you guys very much, and I hope you have the best day ever, and we will talk soon.